Hi. How can I help you today? Okay. Okay, let me just have a look real quick. Yeah, that does look like a pretty good gash on your forehead there. Well, all right. I'll go ahead and take a seat for me for just a moment, and then I'll call you back up in just a second here, and I'm going to get some basic information from you, and then we'll get you in to see the doctor, okay? Okay. Okay, you want to come on up? All right. So I'm just going to need to get some basic information from you. Normally I'd have you fill out a form, but I think I'll do that for you today. Yeah, just to make things easier, more convenient for you, okay? Can I get your first and last name? And could you spell it out for me, please? Terrific. And the best contact phone number, so home phone, cell phone. Great. And your home address, please. Okay, and can I get the name and phone number of your emergency contact, so either a friend or a family member who lives nearby? Okay, wonderful. Are you allergic to any medications? Okay. And do you have any major medical conditions at the moment? Okay. When was your last physical exam or checkup? About 6 months ago? Okay. All right. So, I'll have you take a seat, and then I'll come and get you in just a minute, and we'll send you on back to see the doctor, okay? Okay, yeah, it'll be just a couple minutes, I promise. Okay. Now there's also some coffee and tea if we're there if you like, and some bottled water, so feel free to help yourself. There's also magazines out there. Okay, great. If you start feeling woozy or dizzy or nauseous or anything of that nature, please do come up and let me know as soon as possible, okay? And there are restroom facilities right out that door. All right. Okay, the doctor will see you now. I'll have you step through this door, and then we'll just walk down this hallway right here. And you know what? I'll just go ahead and lead you over there. It's easier that way. It's a little bit of a maze back here. Okay, here it is right here. So the doctor will be right in to see you. She's with another patient, but you're next on the list, so you'll only have to wait another minute or so. Great. Can I come in? Okay, great. My name is Dr. Bloom, and it's a pleasure to meet you, yes. So I understand you have a bit of a nasty gouge on your forehead, right? Okay. Now, how exactly did this happen? Okay. So you fell when you hit a table. Oh, I'm sorry. That's never fun, no. Now, did you just get dizzy, or what do you think caused the fall itself? Okay, you just kind of lost your balance. Okay, well, you know what I'm going to do is I'm going to actually clean the cut up a bit. I'm just going to use some antiseptic because I don't want any infections to start collecting there. And I'll see if you need stitches. It doesn't look like right now you do. It looks like you might just need some kind of a butterfly bandage just to kind of seal the wound. But I'm also going to just give you a brief examination, just kind of test your eyesight. Well, not your eyesight, just to kind of your pupil dilation, I guess I could say. And see how they're responding. And I'm also going to give your ears a quick check, just because judging from what you've told me about losing your balance and feeling a bit dizzy, there may be something going on in your ear. You might have an ear infection or some sort of inner ear imbalance. So we'll give that a look just to be sure. And probably prescribe you some pain medication yeah, since it looks like you're in quite a bit of pain. So does that sound like a plan? So what I'm going to do first is I'm going to get some gloves on just so we keep everything nice and sterile. And then we'll get started with the cleaning of the wound, okay? Great. Okay, so like I said, what I'll do first is I'm going to kind of clean the cut. I just have this cleaning solution here, and I have just these cleaning pads. They're sterile, of course, so I'll put some of the cleaning solution on there, and then I'll just clean the cut. Now this also has a numbing agent in it, so you'll feel a sting for just a moment, but then it'll just be a numbing sensation, so you don't have to worry about too much discomfort. Okay? Okay. I'm just going to kind of clean the area around it too, because it looks like a little bit of blood cut over here. So let's just try to clean you up just a bit. Probably make you feel better too. Okay. Now I'm just going to take a kind of a close look and see what we have. Make sure there's no kind of debris in the cut itself. Sometimes, you know, dust and different particles can get in there, so I'm just going to have a quick look, and then we'll see where we go from there, okay? Okay. Yeah, it doesn't look too deep, and it looks like it's pretty clean, so I don't think you'll have to worry about infection or anything. Which is always good news, right? Okay. Alright, let me just kind of make sure. Is it tender right here when I push around, kind of? No? Okay, good. Just want to make sure you didn't bruise any bones, any of your facial bones. Okay. And it looks like it's kind of a good distance away from your eye, so that's great news. Okay, so I'm actually just going to get out a little, let me open the butterfly bandage. Okay. Okay. And I'm just going to kind of put it across the wound itself, and we'll kind of seal it off, okay? Okay. Alright, you know what? Let me get out one more little one. It's not a deep cut, but it is a rather long one. So we go. Are you doing okay? Okay. What I'm going to do now is I'm going to test your eyes just to see how your pupils dilate, like I said before. I just want to make sure that they have a good reaction time and that there's nothing going on there, okay? You can never be too careful with a head wound just because there's the risk of concussion and that sort of thing. So we always want to just be better safe than sorry, right? Okay. Okay, so I'm just going to use my little flashlight here. I'm going to look in your right eye, so just look straight forward for me. Okay. Okay, go ahead and blink one time for me. And then open your eyes again. Fantastic. Okay, let me do the same with your left eye. Let me see if my flashlight's going out on me. There we go. Okay, your left eye. And go ahead and blink once for me. And open your eyes again. Okay, your pupil response times look great. You write some of this down on your chart just to be thorough. Okay. Now, when exactly did you hit your head? Was it earlier today or just about an hour ago? Okay, so it's good that you came in right away. That's what I like to hear. I have some people that wait a day or two to come in, and anytime it's a head injury or anything of that sort, you really need to come in as soon as possible, just to be sure. Okay. So what I'm going to do now is I'm going to take my flashlight. Actually, again, I'm going to look in your right ear just to see if there's any inflammation or redness. Okay? Okay. Okay, let's see what we have in here. Not seeing really anything going on in this ear. Everything looks good in here. Okay, let's try the left ear then. Yeah, just turn your head a bit more for me. Really want to get a good look in there. Okay, this one looks like it's in tip-top shape too, so you don't have any issues there. Okay. Now, when was the last time you ate something? Last night. Okay. Well, part of the reason you may have gotten a bit dizzy, a bit disoriented, and lost your balance is because you could potentially have low blood sugar. So I want you to make sure that you are eating regular meals. I know that we can all get busy, but it's important to eat kind of a more balanced diet with regular meals. So on your way out, we have box juices, so I'd like you to ask the nurse for an apple juice. I know. I'm an adult and I still drink apple juice out of boxes, so it's not a problem. It'll just elevate your blood sugar a bit. It's natural apple juice, so it's only naturally occurring sugar, so you don't have to worry about that. And you know what? I'm also going to write you out a prescription for some pain medication because that gouge might be a little. It's just extra strength Tylenol that I'm giving you. It's you can't get it over the counter. It's just a step above over the counter stuff. So I'll write that prescription out for you. Here you go. And if you would bring it to any pharmacy, you'll be able to refill. It's kind of something that's always kept in stock. So, but like I said, I really want you to make sure that you're eating normal meals and not skipping because that can really cause your blood sugar to dip. And sometimes that can lead to dizziness, fatigue, that sort of thing, irritability, a whole wide range of symptoms. So it's really important to get your meals in, okay? Okay. Now it looks like you had your last physical exam about 6 months ago. Okay. You know what? I'd really like you to set up. I know this is an urgent care facility, so we don't normally do physical exams or annual checkups. But I'd like you to actually set up another appointment with your doctor. I know it hasn't been a full year, but I'd like you to go in and see them just to be safe. Make sure there's no underlying conditions that might be causing you to lose your balance and kind of get dizzy. Does this happen pretty regularly? The dizziness? Yeah, okay. Yeah, I'd really like for you to go in and see them then, and just to make sure there's nothing going on. Okay? Okay. Well, that was great. It was great meeting you, and yeah, just make sure to grab that apple juice on the way out. It's not a problem. Okay. Well, I normally say I'll look forward to seeing you again, but I hope I don't see you anytime soon. I hope everything is happy and healthy on your end, okay? Okay. You take care. Bye.